First of all, can everybody hear me okay? Okay, good. Listen, it's a real pleasure. It's nice to see familiar faces and clients and uh, people that I've known for a number of years. It's like old home. I never thought in a million years that a guy from Ohio State University would end up with an MBA and 30 years in executive management would end up uh, in an insurance role. But I love what I do. I wake up every morning thrilled. This time of year, it's kind of like it must be kind of like your sled dog experience, Chris. It's like I'm trying to get to December 16th, and I'm on the downhill, and I don't want to let go of the reins. This is open enrollment for both Medicare and for individuals. And I have a number of small to mid-sized businesses that I consult with and provide benefits for. So I got into this business about 20 years ago now, having become a single parent after doing a lot of time traveling internationally as a corporate executive. And all of a sudden, I had to do something different. It was the best thing that ever happened in my life. I figured, I've been in retail, I've been in consumer products manufacturing and distribution. I'm going to try something totally different. Let's try financial services. I got into the healthcare space. It always kind of resonated with me because I had family members with health conditions, and I always had to wade through when we moved around a lot around the country, so I always had to deal with different benefits programs, that kind of thing, personally, and so I started talking about the different groups. Maybe about it would have been in the early, maybe in the early 2000s, and I've learned that whatever you think the rules are today, they're going to be different tomorrow. So I hope you take everything I say today with a grain of salt. This is current as of today, but I can't tell you what the rules will be like in 3 months or 4 months or 5 months from now. I'll also say I love connecting people. I'm one of the top connected people in Dallas Fort Worth with coming up on 20,000 connections, if you will. That doesn't mean any of them I have personal connections, but I do have a number of personal connections. So I encourage you to connect with me, and if there's anybody that I am connected with that I have a personal relationship, I'll be happy to help. What I do is I try to help individuals who are trying to wade through uh, what their what their options are, and I come across different types of people. I have the unicorn chasers that are always looking for something that doesn't exist. I have the Home Depot type that are the do-it-yourselfers that want to know everything there is and are so hands-on that they end up putting a lot of time into things that they really don't have the expertise. And then I have people that it's kind of like being somewhere between a rabbi and a priest and having a background in doing this. Um, uh, the number of people with serious, chronic, and life-threatening conditions that they're dealing with. I have a lot of empathy for that, having known people and lost friends and make new friends that have serious health conditions for themselves or a child or a spouse. And it's different if you're healthy. I can tell you personally that you can think that you're Superman and that can change overnight. And at some point, we're not on this bus ride forever. At some point, that will occur. But trying to navigate the health systems and the options and medical conditions and not going broke is what I really enjoy doing. Right now, for some reason, I've worked with a number of people over the last month with MS. So I've learned a lot about MS. I can tell you a whole lot about different types of cancer, diabetes, you name it. So if you have a condition or you have a family member with a condition, chances are that I can recommend or refer some really good top-notch specialists. Let me get into a little bit of a. That's I'm going to host this stable participant screen sharing. So I think somebody needs to make me a co-host. All right. All right. Let me get to the right screen. And I'm going to make sure you have my contact number because I'm going to ask you, first of all, you may have personal issues, but I'm going to record this for those that can't make it and add it to. All right. Then I'm going to be adding it to my YouTube channel, and I'll be sending the link to Brian for those that can't make it today. So just try to avoid adding information that is sensitive or potentially protected health information. We can talk about that later. I need to get on the right screen here. So hold on one second. There we go. I'm not going to PowerPoint you to death. This is just to keep me somewhat on track. You're going to see my contact info on here. I This is geared for this audience. You know, I picked up some things, wrote some notes, so I'm not going to waste time on things that may not be relevant to this group. And I want to dig down as far and know that you don't you want to. You want to take some notes, but just know that we're going to cover this fast. And feel free to call me or text me. This time of year, it's really hard for me to return emails. I was doing that at 1 a.m. last night, and that's not acceptable during open enrollment. I've got a few links here for you. If you're interested, I'm one of the few geeks that is crazy enough to represent every single Medicare plan in North Texas and in most areas of Texas and 14 other states, which requires months of recertification every year. I do the same for the Affordable Care Act, for the carriers and plans that are available there. Um, I am a I am a commission only broker. I'm not here to push one particular company over another. My job is to help find the best options for your and your family members' health, your budget, out of the options that are available. So there's a lot of hand holding, a lot of education, and a lot of understanding that what's available for an individual is quite different than what's available under an employer plan or COBRA, which is an extension of an employer plan. I also put this up on my YouTube channel, so if you know people that miss this, this is the shortened link to get to that. Okay, I'm as much of a squirrel as anybody else and blink, so just try to take some brief notes. Feel free to call me. Try to avoid the personal questions. You've got my contact info at the bottom of every screen, so you can pick that up. Um, what I focus in on, and by the way, can everybody still hear me? Okay. Okay, good. The last couple of webinars, there were some major audio problems. I really feel that I am a subject matter expert on healthcare. I do a fair amount of consulting for companies that are in the healthcare space. Uh, Over time, my book of business, as it's called, my client base has moved from larger companies to small to mid-sized companies that I like to do business with. The nice thing about not being a W-2 guy is that you can have what I refer to kind of uh, uh, as the no assholes rule, which means you can kind of pick and choose your company clients. But let me tell you, I'll be all over individuals and especially people that are coming up on Medicare or in the already on Medicare that are confused and are like deer in the hot headlights. I go to extreme efforts to really try to help people. Out of that will come other people asking for help in these areas. I also study all of the legislation that's going on at the state and local and HR and compliance. Let me tell you that what's been going on in Washington D.C. and even Austin, but especially Washington D.C. over the last year is just it's amazing. It is absolutely amazing, Karen. And I know I hear a couple of chuckles but that is in the healthcare space. All of a sudden, things have really changed. I'll talk about that. I'm a licensed broker in Texas and 16 other states, and like I said, I represent just about every stinking individual and Medicare plan in those other in 14 of those 16 states. Got 19 years of experience. There's no cost. You pay the same amount. It's like your car insurance. My job, though, as opposed to an online broker or a call center, is that I support my clients throughout the year and help them through the enrollment. It's been a crazy 11 months. There were extra premium tax credits extended about within a month of when the administration changed in Washington. There were also monthly special enrollment periods. There was also premium tax credits for anyone who was who had any amount of unemployment income this year. Now I'll talk about 2022, but this is quite a bit different than how it was. Now, next year, which is only like 6 weeks away, open enrollment is actually extended for individuals who are under 65 through January 15th. So if you know people that are termed at the end of the year, which often happens, unfortunately, they will have an opportunity to enroll for coverage beginning February 1st. The cutoff for January 1st coverage effective date for individuals under 65 is December 15th. Now, there are additional tax credits that were instituted this year that will be extended for all of 2022 and the next round of social safety net legislation in Washington. I guess SSN. I need to turn that into an acronym. That is expected to be passed between now and the end of the year. That will extend those tax credits through 2027. Now, this year there was special enrollment period and maximum subsidies for anybody that had any amount of unemployment income. That has not been extended for this year, but it would not surprise me if all of a sudden, lo and behold, we get an uptick in COVID and things slow down. It wouldn't surprise me if that were to recur. It's kind of like this year has been kind of like the beginning of the Macy's one-day sale with healthcare. That every time you blink, another sale was announced, and it wouldn't surprise me if that continues next year. Also, hospitals beginning January 1st will be required to post prices for procedures, which will be an eye opener for many people and allow people. It's the beginning of a lot. It's not going to be perfect, but it's the start of being able to shop and compare. And if you ever do need a surgery, call me, because there are a number of places that, if you're paying for it out of pocket or if you have a high deductible, there's a number of places that are highly effective with great results that you can look and check out prices. And there's actually some online tools that will allow you to shop and compare and get bids for different procedures. The safety net legislation, which is about to be voted on sometime the next month before the Christmas recess, there's a number of things that are still in negotiation. Now, I will tell you, though, that because of the narrowness of the majority, there will be a rush to get this all passed sometime in the next month, because the midterms will play a big part. And I got to tell you, Texas, because in Texas we have 4.5 million people that are without insurance, and we're kind of turning into a purple state, if you understand what I mean. Um, there will be a major focus on legislation to assist people that are uninsured in states like Texas through through legislation that will help those people and turn them into voters. Lowering of Medicare eligibility. There's legislation that, and again, this is all negotiation, that could possibly reduce the age eligibility of Medicare to as low as 50. There's also been negotiations of adding dental, vision, and hearing benefits to original Medicare, which is not part of the equation right now. Right now, from the latest I've heard, this compromise that it would cover hearing aids better. So for all of you aging baby boomers who attended too many rock concerts 50 years ago, like myself, that's welcome news. Now, this is new for 2022. And I want to spend a minute on this. And this is based on your 2022 household income. Okay, 2021 has nothing to do about it. But if your 2022 household gross income is 150% or less of the federal poverty level, then you will qualify for a monthly special enrollment period and can enroll at any point during the year. Okay, here's how this works. If your household size, if you're a single person, if you have income at 19,320 or lower, then you're going to qualify to enroll in an insurance plan at that point in time. If your household size is 2, the number 26. So, you can have a large family but still qualify. And what that does, that provides the ability for people to enroll throughout the year, not in this artificial open enrollment period in the fourth quarter, which causes people like me to have gray hair and slowly go bald. Also, likely to pass in 2022 is a Medicaid expansion at the federal level for states like Texas. I'm going to talk about that. We talked about the Medicare eligibility, adding dental and vision. Here you go. We got 4.5 million people uninsured in Texas. Federal safety net is legislation will make this. Let me go back. This chart. See, if your income is less than, as an individual, is less than this number here, in Texas, you don't qualify for a premium tax credit. So you're paying maybe as a 50-year-old person, you may be paying $500 a month. Well, if you're making $12,880, you're not going to be able to afford that unless you have this huge savings. What this legislation is going to do, we did not expand Medicaid in Texas, nor did about 20 some other states. So what this is going to do is make insurance available, because people can enroll in it once a month, and it will also make it affordable for people, because this population below 13,000 will now be able to get insurance, and it will cause and it also will be extremely affordable, in terms of dollars per month for a silver plan with very low out-of-pocket maximums in terms of medical expense risk. It will make it very affordable, very very attractive. It will likely be an HMO plan, but hey, that's all that's available. And this is going to have a huge political and economic impact in Texas. 4.5 million uninsured, 13,000 or below, now be able to get insurance. And all of the insurance companies, as I'm going to put up here, they all know this, and they're all targeting this, both in the individual and in the Medicare market. There's uh, uh, the Improving Medical Coverage Act. Uh, if this goes in, and this is 60, it may get, depending upon compromises and how the sausage is made, it could get reduced to 55 or 60. That would expand coverage to at least 23 million people who may otherwise be uninsured, but more likely are going to have come for an employer plan because Medicare, in most cases, is more affordable and is better coverage than what high deductible health plan many companies offer to their employees. What that means is fewer people um, on employer plans and more people having to shop for their own coverage for the first time. Other changes. Insurance companies are already, the rumblings are that they're starting to charge for COVID testing and treatment, especially self-insured companies. Companies that purchase reinsurance to cover the risk or just cover the risk themselves, they're going to be the first to do this. Because there have been so many misdiagnoses and mistreatments due to COVID. In fact, I've heard rumblings within the past week that hospitals are starting to fill up in the area, that doctors' offices are starting to close due to COVID outbreak. But for right now, there have been so many misdiagnoses that you're going to see an increase in chronic diseases. There is also the possibility, this is happening in the life insurance business, that life insurers are starting to underwrite the additional risk of COVID exposure, especially long haulers. But there's a possibility of higher health insurance premiums for unvaccinated, like there is for smokers. There's also, I know a couple of folks here are in the HR world. Mandatory vaccination and testing policies are going to cause HR people to pull their hair out. And those of you that are in the HR space will probably want to bone up on that because this is a hot button issue right now among employers. Other changes. Those of you that are on Medicare probably have come across what's called a star rating system. Pretty simplistic but effective. The more stars an insurance company receives or a plan receives, the more the insurer gets reimbursed by SAM. It also is a good shopping tool for individuals looking for insurance, and that's going to start being used in all Affordable Care Act plans in 2022. There's also this No Surprises Act that was postponed, and it's not perfect legislation, but it's, I think, a pretty good start that is going to protect consumers from out of network billing, surprise billing issues, especially at some of these urgent care centers that will tell you that, yeah, we'll take your insurance. That doesn't mean they're in the network and you get stuck with a big bill. All right, I'm going to talk first about individual insurance for people under 65. First, and again, the backdrop I started with in terms of expansion. You have several new insurance companies coming to Healthcare.gov in Texas. If you haven't been to Healthcare.gov, you're going to see some new names. Bright Healthcare, very, very innovative company here in North Texas. Aetna CVS is introducing insurance in a number of states, not in DFW to start. They're in Austin and in other areas of Texas, but I would expect them to be full blown in the Dallas-Fort Worth area in 2023. United Healthcare is re-entering the market for coverage through Healthcare.gov with a suite of products it's not the United Healthcare network you've had from an employer. I'll talk about networks. Other insurance companies are expanding in other states. Cigna's not here in Texas, but they're expanding. A company called Oscar, which is partially owned by Google's parent, and other companies you would or venture caps you would know of. very innovative. They're expanding throughout Texas. A company called Clover, uh, one of the most tech savvy and smartest companies in the country, very high valuation. They're actually partnering with Walmart in Georgia and expanding, and are in South Texas and Bahar counties and elsewhere in the Texas. And eventually, a number of these companies have been expanding. The smaller companies have been expanding, hoping to get bought out by United Healthcare or an Aetna, because it's right now the gold. It is the gold rush, and I'll talk about that in a minute. Everybody is expanding the number of counties, and this is helpful because up until now, Blue Cross Blue Shield, which is the most expensive of the plans available, apples to apples comparison with other companies, they have providers in every county in the state. Well, as of these other insurance companies expand in other counties in Texas, that means you're more likely to be in network if you go visit kids or friends in other counties. You're going to see, there is similar expansion in Medicare and Medicaid plans also. Who knows who this guy is? All right. This is Johnny, take that job and shove it paycheck. Now, why is he up here? Well, did you see the news that there were 4.4 million people that quit last month? That is incredible. Now think about the churn at companies that have done everything they can to slice themselves to the bone, and now we're hiring people back while half the workforce is going out the back door. That has tremendous impact for Cobra as employees leave. It has tremendous consequences, certainly for HR people and recruiters. But think about 2 or 3 more months of more than 4.4 million people. 4.4 million people is what, about 2% of the workforce, something like that, or 3%. This is pretty huge, and it's going to keep this and come back to work in a real physical office, and you better get a COVID test or vaccinated. It's going to keep HR people hopping. So if you're looking for hot buttons, and especially in the benefits field, this is a couple to keep your eye on. All right, new company, Bright Healthcare. Very simple product design. Their CEO was in town 2 weeks ago. They have a great strategy. They're expanding in 26 states all at once. Why are they doing that? They're hoping to get bought out by it's a little fish getting beat up by a big fish, but they have very excellent plan designs. Silver plans offer zero copay, low copays on specialty care. It is an HMO network. They offer wellness incentives, telehealth. Their provider network. This is primarily for people that are healthy and don't need to see a specialist on a regular basis, because the provider network at this point are a subset of the Medical City network, and it's an HMO plan. Here's where they're at. You can see Dallas, Fort Worth, Houston, Austin, San Antonio, and El Paso, the big areas, and also the areas with the highest uninsured. This says 3.3. It's actually 4.44 million in terms of uninsured. So they're targeting with products. United Healthcare, another company. A lot of emphasis among all the companies now on telehealth, telemedicine, being free or almost free. United Healthcare is HMO plan, and it uses not the United Healthcare network, but a subset of the Medical City network. You can get a free 1 year Peloton membership, which is pretty cool. I think it is a real coup for a local company that needs a win. You don't get the bike for free, but it is a very effective exercise program. And the more you can stay healthy and out of it and fit, the more it's going to do for you now and 10 to 20 years down the road. They'll also give you a reward just for getting a checkup with a primary care physician. What they have done though is they have every possible product plan and network with different names: Essential Plus, Advantage Plus, Value Plus, Virtual First. But they're all HMO plans, and really requires some deciphering uh, to really know what the difference is between one or the other. And the tendency, uh, I'll talk about the tendency for everybody is always to shop on a price basis. And when you're a confused mind never buys or buys on price. And in the area of healthcare, that can be a dangerous thing. There's two different HMO networks. There's a narrow and a broad. There's also virtual telehealth, and there's all the So it's also the telehealth. It's smart strategically. They're funneling telehealth visits to their Optum doctors, and Optum Health is a United Healthcare specialist. So that's a smart strategic thing to do. Aetna, not a factor here in Dallas Fort Worth. They'll be here in 2023, I'd assume. They're using their retail strength. You'll have um, access to all CVS Minute Clinics and health hubs across the country. Even though it's a local HMO network, you'll get store discounts, so you can buy your snacks, I guess, at CVS after getting a checkup. But they're leveraging their strengths. This is a company. What I've found since the rates have been released, I did not think this. I thought other companies would be from what they were explaining during their kickoff meetings. Other companies might be more cost competitive. This company called Friday is out of Colorado Springs. Their second year in Texas. Uh, Very straightforward plan designs, easy to understand. They have the lowest cost, and what I've been seeing is the best value silver and bronze plans in DFW for the most part. But they have an EPO network, and you may not have heard of an EPO network or known that you may have had one but didn't know what it means. It means there's no coverage out of network. There are no PPO plans in Texas. You'd have to move to Oklahoma to find a PPO plan in the individual market. And living in Oklahoma has its negative consequences. Those of you at OU, sorry, I'm very proud of my Buckeyes. EPO network, though, you don't have to get a uh, referral to see a specialist. So this can be very useful when you're trying to get in to see a specialist. It can cut weeks or in sometimes months to get in to see somebody just by picking up the phone. A little thing like that isn't talked about, but they're also very, very competitive and better. This is uh, the brand, the ACA brand in Texas of Centene. Centene is now the largest health insurer in the U.S., believe it or not, and it's a company you haven't heard of, most likely, Centene. They insure over 100 million people across the country, believe it or not. And many of those people are on Medicaid and Medicare plans. Their ACA brand is Better. They give you access to Baylor Network, Medical City Children's, and some medical hospitals, wellness incentives. They confuse with this EPO and HMO plan. So you're seeing almost every carrier now, including Blue Cross, offering a low price point and a high price point, and much difference in terms of access to doc. The more access people get to see a specialist or to see physically, as opposed to telehealth, see a primary care physician, the more it costs, and that's being reflected in the plan designs. So here you have two different HMO networks by uh, by Ambetter, and an EPO network, and then a virtual access network. So again, it's pretty confusing. Why does this all happen? Insurers are betting big on the progressive social safety net expansion. They're also benefiting from low cost of capital, and so they're expanding their territory as fast as they can. Overall, also the Blue Cross Blue Shield affiliates across the country, they've been pretty complacent. They have not, they've never been known to be great marketers, but they have been complacent compared to their competitors, and so they're taking, and every insurer must make money. Okay, there's a limit to how much money they can make, so they make underwriting decisions and pricing decisions, but they don't often make decisions on overhead. The bloat in the blues is pretty incredible compared to their counterparts, and it makes it harder for them to be competitive and harder to compete. Health insurance, though, because of the amount of subsidies, people, you know, people get desensitized with just how expensive healthcare is. The ability for somebody this year who made pull down six-figure income as an individual to get a premium tax credit based on having any amount of unemployment income, that has given a whole new experience to millions of people this year who never had to shop for their insurance, and now they understand what's involved here, and they have a better appreciation for the difference between an employer's plan and an individual plan. But the sale mentality is still going to go on. Now, because of all these different provider networks, that every insurance company is offering, it is very confusing, even for somebody that studies this. The idea, and as a result of the confusion, people shop on price and also at renewals. People that had an insurance plan in 2021 now get the renewal notice. Well, that renewal, if you do nothing, you may be moved to an HMO plan or a narrow network plan or some combination of them, or a virtual telehealth network, in order to keep the premium outlay the same. What does that do? It masks the inflation that is occurring in healthcare. Healthcare is continues to be out of control. There was a healthcare expenditures last year and this year because of the pandemic. People weren't going to the doctors or hospitals that much, but the overhead's still there. The doctors and specialists are still there. The equipment, the lab tests, the X-ray machines and imaging machines, they're still there. So it continues to be uh, expensive and rising in cost, and increasing in the cost share or deductibles or out-of-pocket maximum financial risk that individuals must bear, and that's occurring on the employer level too. From an education standpoint, 95% of Americans don't know the difference between PPO or an EPO network or a broad or narrow network, and so it's very difficult to make comparisons and check availability of doctors. And I can tell you, I subscribe to services that it still takes a lot of time, but you can when you have now 9 companies in Dallas Fort Worth that sell insurance plans under age 65, and there are over 37 or 38 in the Medicare market, and you're trying to trying to see how do you keep specialists, how do you keep deciding which plan based on which doctor is in which network. You can spend days as an individual trying to do that. I can get it down to probably about an hour. So, and that's what I do. I help people match the need for doctors, network access, and have to do a lot of explaining that unicorn plans that have everything you want, that's a PPO plan, as a low deductible, and all my doctors are in. Those plans probably don't exist, but I can certainly help you find the best of what's available. Medicare, this was announced last week. For those of you that are coming up on Medicare age or already there, this is a little concerning, and there was really no need for this. But historically, earlier this year, there was the largest Social Security increase of 5.5% due to uh, due to the formula for Social Security. 2 months later, Friday was announced that we have historically the largest increase in Medicare premiums of 15%, and also of the Part B deductible of 15%. And for people on fixed incomes, it may not be the group in this group, but for people that are in their 70s or 80s or on fixed incomes, or let's say they are disabled, this is very, very incredible. However, Uncle Sam's Medicare A and B is still an incredible bargain. And I would not be surprised, due to the inflationary nature of healthcare and the economy in general, if we start seeing a couple years more of inflationary increases like this. Also, there are a number of new Medicare Advantage carriers entering the market. The number of Medicare and Medicaid plans targeting the 4.4 million Texans that are uninsured, boy, they're just growing like weeds. There's more plans to address chronic illnesses like diabetes, COPD, and you may not know this, but insurance carriers get reimbursed based on their star ratings. And it's not like they get reimbursed more today for improvements they made 2 years ago. So there's a lag, but they get paid more, reimbursed more, the more Medicaid people that they have insured, and the more chronic illness uh, uh, members that they have insured. So there's a lot of focusing in on that 4.4 million people, and also more hospital health system owned insurance carriers. You have Christus expanding in East Texas. Baylor Scott and White obviously has their own network, and Texas Health Resources, which is Presbyterian, UT Southwestern Methodist, has their own insurance plan as well, and that's throughout the state. Now, you're one, okay, Mike, that's great, reporting. Now, what do I do with all this? I'm going to go through and share another screen here, and I've put together some lucid charts that I haven't shown to this group that will help explain the decision process. That if you want to do this yourself, I mean, it's helpful to explain this. This is what I do, but I can explain how this works and the decisions you have to make. This is a family. Okay, let me pull this up for an adult couple, since there are probably some that um, have kids in college, but maybe not people in their prime of childbearing years. No offense, folks. I'm trying to say that delicately. Um, you have, let's just take a typical adult couple. What are the factors that you have to think about in terms of insurance? The first thing is age. Are you under or over age 65? And really, at about age 64, you're going to know, because you're going to start getting pounded to death with junk mail and robodials and spam like you have never seen in your life. Because every financial institution, every credit card company, everything, they've been mining your data for 20 years, and they know exactly when you're most likely to be looking at this stuff. So you're going to get pounded. The first thing let's deal with over here, 65. Okay, and I'll go back to Medicare in a second. First of all, if you're unemployed or employed, um, I want you to think about if you're a family, if you're a couple or a family, quit thinking about everybody having to be on the same plan because that can cost you money, and somebody in the family could be overinsured as a result, and somebody could be underinsured. So you always want to look at individual when you're looking for individual insurance plan. Don't look at a couple plan. Look at you can even on Healthcare.gov. I can help a couple have two different plans, and Medicare is all individual. It really matches the amount of health care that you want to that you need to cover the financial risk at the best cost. So you have under 65, unemployed, employed, and I guess also 1099 here because you're purchasing individual insurance as opposed to employed. You have what are called minimum value plans, which have mandated wellness benefits, and also are actuarially estimated to provide the minimum level of coverage. And then you have minimum essential coverage plans, which are often offered by staffing agencies or the like. That minimum essential coverage, all that does is cover the mandated wellness exams like a colorectal exam or mammogram pap smear, but more importantly, it keeps the employer from being fined for not offering a full health insurance plan to any full-time employee. That happens with any company over 50 or more employees. Um, Now, on this side, these are all, I'm going to talk about this. You have COBRA as an option, right? COBRA is a group plan, and in Texas, if you have 20 or more employees, you have to offer COBRA. If you have fewer than 20, then you are able to offer, and it's required. The insurance company actually offers it. Uh, it's called state continuation. So the size of the company impacts whether this is COBRA or state continuation. You have plans through the Affordable Care Act. I get so many people asking, well, those are healthcare.gov. That's government insurance. Don't you have any private insurance plans? Well, they're all private plans. They're all regulated by the government. The healthcare.gov is the funding mechanism for you to be able to receive a premium tax credit and then purchase. It's the only place other than employer plan as an employee or COBRA as an ex-employee. It's the only place where you can have any and all mental, emotional, and physical health conditions covered. Everything else is going to deny coverage for pre-existing conditions. Yes. Yes. Yep. It, yeah, absolutely. It was announced in June, I think, that retroactive to April, people would be eligible for 6 months of free COBRA that the employer would pay for and then get reimbursed by Uncle Sam. That expired at the end of September. That doesn't mean it won't come back as part of a one-day sale, Macy's one-day sale strategy by Center for Medicare Services or Washington, D.C. I think a lot is going to depend on the stability of the economy and the recidivism of the pandemic. If we get back into full lockdown, you may see some of the stuff coming back. But right now, the problem is an overheated economy with labor shortage and supply chain shortage. So they're putting the brakes on some of that stuff. Where they will do this, though, is from a political eye, where they can feel that they can get votes in certain segments of the population. Then you may see some of this, but it may not be. It will be most likely to be for people that are that have income at or close or less than the federal poverty level, because that's first of all people that need it. Okay, I'm not making value judgments here. It's the people that need assistance, but also that's where it's going to serve the administration well to do so. And in states like Texas that are close to being a swing state. So I would say no, there's no extension of that, but there could well be tax credits for unemployment income announced next year, or some free COBRA. But I don't think we're in the dire situation that we were, fortunately we're not, that we were at the beginning of the year. Yeah, you have a lot of companies selling what are called indemnity plans, where they will cover up to fixed amount in the event of accident or injury or illness. And I gotta, these are sold on the basis of price, and usually by relatively new agents that have not really, they've been indoctrinated that these are the greatest things since sliced bread, but they leave you exposed to a lot of financial risk, and I got to warn you about that. Where they make sense, though, is that when you're looking at an Affordable Care Act plan, a bronze plan with an $8,700 calendar year out of pocket, well, getting a indemnity accident plan or a critical illness plan that pays a cash benefit to cover that deductible in the event of a heart attack, cancer, stroke, or accident, that might be a good way of supplementing a plan through the Affordable Care Act to reduce your financial risk to something more tolerable. You also have short-term health plans. These do not cover pre-existing conditions. United Healthcare is the largest marketer of these. They will underwrite, so based on your health, you may or may not be eligible, or you may pay more, but no conditions will be covered. Mental and emotional health is not covered. Maternity is not covered. They have their place, but primarily, my view of this is they should not be looked at as something other than to tide you over and like to the end of the year, if you find yourself without coverage, or to cover a college student until they're eligible for an employer plan or a student plan. Don't use this as ongoing, because there's just too many holes in it. You also have Christian healthcare sharing ministry programs. These are not insurance programs, but they're legit. I was on one, even though I'm an insurance broker. I was on one for 5.5 years. Some are excellent, some I would run away from, but they don't cover pre-existing conditions, at least for the first 3 years. But they're legitimate. Many of them, if they were an insurance company, they would be. They have enough members to handle large claims. Others do not, and go bankrupt. But the largest, if it were an insurance company, would be in the top 10 of the country. Medicaid varies by state. I'm going to spend a second on Medicaid. In Texas, as of right now, you qualify for Medicaid if you're a child under the age of 19, if you're a pregnant woman, or if you're an adult age 65 with little or no assets or income. And this varies by state, but those are the rules in Texas. I can go into more details. You may know people, and also at some point, people may have spent their money in long-term care or in healthcare expenses, or just not have had a lot of money, Medicaid at some point is a path for people if planned properly. It's a path for people to have health coverage in the event of little to no income, and that income has to be less than what you would make in Social Security, and assets of you know less 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 than well, I won't put the amount, but less than 20 grand and very little money. Also, people that uh, travel either on business or in moving to another country. There's a lot of people now that have laptop jobs, can work anywhere, that are working in Tulum or other areas in the Caribbean on a beach somewhere. At least it sounds fun, but there are a lot of people actually doing that. Uh, they their U.S. health plan will not cover that. Medicare will not cover that. But international coverage, expat coverage, or short-term coverage is super cheap, and because healthcare is pretty inexpensive outside of the U.S. And then you also have VA and TRICARE for people that are veterans and participants in the military. The worst thing you can do is obviously right here, no coverage, because the financial risk, the access to care, is just not worth the risk. And I've been in this long enough to know of people that thought that they would cover that risk, even in pre-pandemic years, and they didn't make it, and they left their family with uh, with bills to pay. Now I'm going to talk briefly about Medicare for people that are under 65, because there are a couple of traps here. As you're and this is for this group, this is really important. Basically, you get Medicare A and B through Uncle Sam, Medicare.gov. You actually purchase it at SocialSecurity.gov, which is kind of um, the wrong place to get it, but that's where you start out. Medicare A and B cover 80% of your medical expenses, uh, but there's no cap to the rest of it. You have people that have low assets and income over age 65 that can qualify for Medicaid and additional state and federal funding of the remainder expenses. If you are age 65, though, here's where you end up in some problems. When you're age 65, you never want to select COBRA. And this is oftentimes, I would say probably more times than not, this is not communicated, or it's just another form from HR or your former employer that you never pay attention to. People over age 65 should not enroll in COBRA. If there are fewer than 20 companies or 20 employees in the company, you must sign up for Part A and B when you turn 65, no matter what. If there are 20 or more employees in a company, then you can stay on Part A at age 65, or you can decide not to go on to the employer plan and sign up for A and B and then purchase supplemental coverage. But what happens if you sign up at age 65 for COBRA, or 66 or 67 or 80? What happens is that after 6 months from your termination as an employee, okay, as a W-2 employee, not as a COBRA participant, but after 6 months, if you signed up for COBRA, then you will have missed the enrollment window to enroll in Part B and Medicare, and what that means is that you won't be able to sign up, and you will be facing penalties for the rest of your life for every month that you did not have coverage from when your employment ended. And even worse is that you will not be able to enroll in Medicare until the following July. So let's say right now you sign up for COBRA for a job that for coverage that ended in let's say September. You waited 60 days. You didn't you decide to sign up for Cobra on the 60th day because you got a form from HR, and you're 65. Well, after 6 months from that September date when your termination ended, then you're going to be faced with fines for the rest of your life for every month that you didn't have coverage, and you wouldn't be able to enroll until the following July. So if anything were to happen to you during that time, or spouse, and you didn't sign up for Part A and B when you turn 65, that's a problem. The options at age 65, you have to look at cost versus risk versus access to providers. When you first turn 65, you have when you first enroll in Part B as a boy, you have a period of time, 3 months before you enroll, and then at age 65, your birthday month of turning 65, and 3 months afterwards, or when you leave an employer plan, 60 days from leaving an employer plan. If that's your first time enrolling in Medicare, that's your time period when you can sign up for Part B as a boy. You can purchase a Medicare supplement and a Part D prescription drug plan, and that you don't have to answer medical questions. Or you can purchase a Medicare Advantage plan with prescription benefits, and this will have a network of doctors and hospitals. About 90% of them are HMO plans. There's some real good plans. However, they have networks of doctors, geographic networks, and after that initial enrollment in Part B, then in the future, if you want to purchase a Medicare supplement plan, and the benefit of a Medicare supplement plan is that you can see any doctor anywhere in the country as opposed to a network. Any doctor that accepts original Medicare, to this day, 95+% of all doctors accept original Medicare, and almost all hospitals. Hospitals will go broke without Medicare. So just about every hospital accepts Medicare. Not so with the Medicare Advantage plan. You have networks of doctors and hospitals, and so there's limitations in coverage. But here, you have this initial enrollment period where you don't have to answer medical questions at age 65 or when you leave an employer plan. If you purchase a Medicare Advantage plan, then in the future, if you want to reduce your out-of-pocket medical expense risk, then you have to answer health questions, and the application will be underwritten, and it will be rejected, or you'll be charged more as a result of those health conditions. And why do I bring this up? Because every year I have people coming to me that didn't know that they had to sign up themselves or their spouse at age 65, and they're now in that risk zone of having to wait until July to have coverage under Medicare, or they didn't sign up and now they're subject to penalties, or they didn't know that if they sign up for Medicare Advantage plan, they're now looking at out-of-pocket medical expense risk for the rest of their life of at least $3,900 per year, to as much for a PPO plan. The going amount is about $6,900 in network, or $12,000 out of network. So it's not only a cost factor, but it's a risk factor. Imagine having a chronic health condition where you have significant, expensive, or life-threatening medical conditions. You're going to the doctor often, or a spouse. Well, what happens to your savings if you're spending $3,900 a year at the minimum, or somewhere between $3,900 to $6,900 before everything is covered for the next 20 or 30 years? Not too many people have that kind of savings, and very few financial advisors. No offense, Brian, but this isn't something that is talked about, nor is the risk. HR really understand this in a way to make these decisions important. The worst thing you can do at age 65 is delay in enrollment in Part A at age 65, the absolute minimum. You get penalties for that. If your company is less than 20 employees, you want to sign up for A and B. Otherwise, you'll get penalties for that, and you'll be responsible for the portion that the employer health plan would have paid. The other thing that is an issue is if you don't sign up for Medicare when you turn 60, when you leave an employer's plan, then that leads to the late enrollment period and late enrollment penalties. So all these things, at the last time I gave a presentation about 6 weeks ago to a group, and a very accomplished HR person actually wasn't aware of some of this, and caught her. Didn't realize that, and her husband got trapped in that late enrollment penalty and late enrollment period, and won't be able to get covered until July. Why is that important? Well, it's just something you have to know in advance, because I tell you, the days of stopping employment at age 65 and retiring and sailing every day like the Pacific Life ads, with whales splashing in the background. Most of us are working at age 65 and beyond, age 70 or 75. And so understanding this and the traps and pitfalls here is important. And you may not be 65, you may not care, but at some point you'll be there, or you may have colleagues that just watch a TV ad and sign up, or just sign up for COBRA, and they're not really understanding what the issues and the risks are. They're shopping on the basis of price, which is a problem. Now I've got the keys are cost versus risk versus access to doctors and hospitals, and how it impacts your future options. There's also under Medicare, just like there is under the Affordable Care Act plans, the more you make, the more expensive your insurance costs. With Medicare, it's something called IRMA. If you're an individual who has a household income of $88,000 or above, or a couple $176,000 or above, your Part B premiums and your Part D premiums will be taxed quite significantly. It's a stepped up amount. You can be taxed on those amounts, but if your income is below 88,000, it's a 2-year rolling average, first of all. So if your last 2 years income was 88,000, below 88,000, then you don't have to worry about IRMA taxes. If it was a $500,000, which can happen with buyouts and bonuses or sales of property, $500,000 or above, you would be looking at an extra $500 in taxes. But generally, a Medicare Part B for 2022 will cost $171 a month. Okay, and Part A, if you've worked 40 quarters or 10 full years, then Part A is no cost. That covers 80% of your medical expense. For at age 65, for under $300, you can get a Medicare supplement plan and a prescription drug plan, and your only out-of-pocket medical expense for the year is about $270, and whatever your copays are for your prescriptions. The Medicare Advantage plan will you're not paying the premiums for a Medicare supplement, because most of those plans are zero premium. Uncle Sam pays an insurance company about $4,400 for every Medicare Advantage member that an insurance company has. So let's say you save $100, and at age 65, if you're a woman, it might be $135. If a guy, might be $150 a month, in that range. So you're saving $150 per month in premiums for Medicare Advantage plan. So it may cost you about $150. Well, it'll cost you for Part B. It'll cost you $171 plus whatever the IRMA taxes are. So you're saving maybe about $130 for the for having a Medicare Advantage plan. but it does limit your options to care in the future, even though you may be perfectly healthy now and your spouse that may change. It will change at some point in your future. It will impact your risk and your access to care, just like it happens over here. If you're making more money, at, if you're under 65, you're going to pay more for health insurance. As an individual, the tax credit goes away at about $50,000, roughly, give or take $1,000. For a couple, it's more, but if you have a family of four, it may go up to $90,000. And the lower your income is, the closer to the federal poverty level or below now, if this legislation goes into effect, the richer the benefits and the less you have to pay. And that's just the way it is. So it is going to force value judgments. We're not there yet, but it will force value judgments because I know of people that make the decision. Many of them are above, they may be in their 70s. People in their 70s, it's not untypical to make decisions that mean uh, no mortgage, sell the home to pay for medical expenses. That will eventually happen due to inflation. There's nothing that's reducing inflation, but eventually those kind of decisions, people will, if they're healthy, they need to be managing the risk so that they don't end up with the decision of having to reduce, or liquidate assets in order to pay for health care. But that balancing of what's important in life and what things cost, we're all kind of being lulled to sleep due to federal subsidies. That health care is expensive. That's part of the reason why insurance is expensive. It's not the only reason, but it makes it harder to make consumer uh, consumer decisions because of all this complexity. And one thing I do, I study the regulations and develop strategies that help people. I represent every stinking plan that's available in Texas and other states, so that you don't have to. And it's not something I would recommend. I don't know of too many people that do it the way I do it. I'm going to go back to I think this is it. Yeah, the tax credit is only available through Healthcare.gov. And what that does is uh, if your income is at a certain level, premium tax credit, you it re, it's called an ACPCT advanced or APTC. It advances subsidy from Uncle Sam based on your income that reduces the cost of your monthly insurance plan. There is no there is no if you're eligible for an employer plan or COBRA, you're not eligible for premium tax credit. If your income right now, if your income is below as an individual 13,000, you're not eligible for premium tax credit. That may change, but what that does is it reduces your insurance costs. It also, if your income is low enough, below 150% of the federal poverty level, and you select a silver plan, um, you will also be have your out-of-pocket expenses subsidized. So your deductible will be lower, your copay will be lower, your co-insurance will be lower on a sliding scale. At 13,000 to 20,000 is low. It goes away for an individual at like 50,000. Sure. Hmm. Yeah, there's a good question. Who's speaking? I'm sorry, I don't have the. I was Ellen. Yeah. Um, you can, but with a few conditions. There's a time period when you can disenroll from Medicare Advantage and go on to original Medicare. That is January through March. So the time period to do that is January through March. And you can then enroll in a Medicare supplement plan. But you have to, if you've been on a Medicare Advantage plan, uh, that means that you would have to submit uh, application that includes answering health questions and could be denied and would be denied coverage based on pre-existing conditions. If you're perfectly healthy, no problem. Once you go on to original Medicare Part A and Part B, you can enroll in a Medicare supplement plan any day of the week. And once you disenroll from a Medicare Advantage plan, you can also then enroll in a prescription drug plan to go along with the Medicare supplement plan. Yes, yeah. So as time goes on, you're more likely to have medical issues if you don't already have them at age 65. So the longer it goes, the more likely it is that you won't be able to qualify for a Medicare supplement plan, or will pay a lot more. Yeah, thanks for the question. So there's a lot of stuff here. I'll be. You've got my phone number. Feel free to text me. I'd be happy to answer personal questions. There are very few things that I haven't dealt with at this point. There's no cost in any of this. I do this, this is my own little mini ministry. I don't do this for the money. I do this because it's a fascinating area and I enjoy serving and helping people. Really, to get started, it takes about 5 minutes. I'm one of these guys. I'm old school. Okay, I was indoctrinated early in my sales and marketing career to answer a phone call on first ring if I could. So I just instinctively pick up the phone and say, "Hi, this is Mike Chapman. How can I help you?" If I'm on the phone or on a webinar like this, I can't do that, but I'll answer phone calls afterwards. As a result, I'm not able to really start my workday during open enrollment until about 11 o'clock at night. So it's really better to text or call because I may not be able to reply to an email for a day or so. But you can connect with me on LinkedIn. You can send me a LinkedIn message, text me, call me. Uh, Email me if you don't mind the wait. But the best thing to do is just give me a call. 5 minutes, I can get the questions I need answered, and I can follow up and send you proposals. I don't push one plan or another. This may not be something you're wanting to do now, but every year, some people want to do it themselves. My name at Healthcare.gov is Michael Chapman. My broker ID is my email address. My national producer number is 7751382. If you do enroll in plan through the Healthcare.gov, it doesn't cost anything, and that way I can support you and answer questions for you with your hospital, with your doctors, with Healthcare.gov and insurance company, and I help keep a roof over my head. You know other people that have this? I will tell you, I will post this. I think this actual recording went through, so it's been 36 or 40 minutes. I've been yammering. I'll put the link. I'll give Brian the link to this to the YouTube video once the recording is completed and rendered. And thanks. Here's the link again, and look forward to helping you any way I can.